explain why it is people are so fearful? They've been so critical, many people, of Kaci and of Dr. Craig Spencer for what they claim was endangering the lives of the public. Could you explain why that's not really been the case?
You know, it really isn't the case. We know from science and epidemiology that if a person is completely symptom-free, if they haven't had any known exposure with their skin or anything else, they have no temperature, and if the health department would proactively monitor them, I'm all in favor of that. Then if they want to get in their car or if they want to have a walk on the street, they're endangering no one at all. And as I say, from a matter of law, the doctrine of quarantine requires that you have an individual assessment of significant risk, and it doesn't exist here. The CDC itself does not put her in a category that would warrant quarantine. They've guided the states in that way. They've asked the states to behave in a way that comports with science. And unfortunately, we're coming up to elections. Politicians are wanting to follow the polls. They're basing their decisions on fear rather than science. And while sometimes that might be an okay thing to do, not if you're depriving somebody of liberty, and not if you're really making a situation in West Africa worse than it is.
Maine Governor LePage is one of the most conservative governors in the country, and his Health and Human Services Secretary spoke yesterday. What they didn't explain, they have police outside of the home where Kaci is staying. They have not directly said what they're going to do to her if she goes outside. But if they're saying she's contagious, right, the New Jersey governor, Christie, said she's obviously ill, which was obviously wrong. Are they going to be wearing moon suits and tackle her? They will not explain what they're going to do to her.
No, and in fact, unless they've actually issued a formal quarantine order under the state's public health law, the police actually have no authority over her. She's committed no crime. There has been no assessment that she actually, from a scientific point of view, poses any risk to anyone. I don't see that they've got any authority. Now, if they get a court order, they're going to have to convince a judge that their decision is based upon a rationality and science. And I don't see how they can do that when the entire scientific community disagrees. And they're just they're fanning the fear in the public. The public are wondering, why are we getting all these confusing messages? The president saying one thing, a governor saying another thing. The WHO and CDC have their own position.
Well,
we have to have a consistent position.